just for the NT health hospital systems treat me according to the toxic chemical health monitoring. Is that right? Just hung up on me again. Good on you, NT Health. That was a minister for health. Just hung up on me. Such a great bunch, eh? Imagine if it was COVID. So here we'll overview this stuff, what they've been failing. Asking a patient a few initial quick screening questions is critical. They don't ask you that. And may flag the need to take a more extensive exposure history. They won't take that. Given that the time constraints, primary care settings compete with the need to identify a patient's potential environmental, occupational health exposures. It is highly recommended that a few short screening questions be incorporated into the routine, blah, blah, blah. So I've just had an environmental scientist from NT Health totally deny that they have any responsibility of this. He says that the public must individualise chemicals, even though it says quite clearly in here that they can't actually individualise them. And they need to take a holistic approach. So if it suggests a potential, now I've already know that I got it. No extensive exposure interview was had. They didn't look up my exposure history. The detailed initial requires occupational exposure, environmental symptoms, and medical conditions. I'm getting real tired now. Anyway, we will continue this another day. Dealing with them. So they know screening's been done, they just totally ignore that it exists, that these steps exist. Apparently now I've got to go back to Bunnings to go gather this information here, where I got exposed, and within 20 minutes I was having serious exposure effects. This wasn't done, no urine sample taken, no evidence of contamination they weren't willing to do. That's EPA are not willing to get this, or NT Health. No laboratory tests were done at all. Another failure of just basic toxic chem care. Consult with appropriate specialists. Nothing. There's no follow-up. Report the pesticide incidents. Contact the appropriate state health agency, which I just done, and they just hung up on me. Even the Minister of Health did so. Now, the health professional only needs to suspects that a patient, they don't even need what they claim dead set evidence, straight linking to individual pesticides. Report to the appropriate state health agency. If the healthcare professional states that the report should send. Now, all of this is a American EPA, as you can clearly see. Why I have it is that the Australian health are meant to be following it. They say that they piggyback off EPA, American EPA standards, which they clearly don't. It says, while a diagnosis can be based on a group exposure, no, it doesn't say anything about individual. Therefore, the clinician must collect the information needed to document exposure, symptomology, and confirmatory data for individuals involved. Now, since going to this Bunnings in Coconut Grove, I've spoken to a few people about it, and some people do say that they don't actually go there either because of the smell in there. So now that this environmental scientist that I was talking to claims that, oh well, if you know a place is dangerous, then why do you go in there? And I kind of said to him, well, from the outside, you would think that a public place is safe from all these toxic chems, and from the outside, you can't actually see any kind of fumigation happening inside a shed. And that's why pesticides stored in a shed space are not meant to be stored near food products in the same shed spaces where workers are eating. Yet Bunnings have a cafe not even 5-6 metres from the pesticide aisle, which apparently NT Health seem to think that's fine because that's the public and not a workplace. So that's a good one for you, public mob. Very worried about corona, but not about the toxic chemicals.